Welcome to our deep dive into the world of anesthesia machines. You know, the big, complicated-looking machines you see in the background of every medical drama. Today, we'll explore the essential components that make these machines vital for safe and effective surgical procedures. Think of the anesthesia machine as the unsung hero of the operating room. It's the anesthesiologist's best friend, ensuring patients remain unconscious and pain-free during surgery. But it's not just about putting people to sleep. We're talking precise control over breathing, monitoring vital signs, and responding to any changes in the patient's condition in real time. We're going to break down each component of the anesthesia machine so you can understand how it all works together to keep patients safe. Let's start with the gas delivery system, the foundation of the anesthesia machine. This system includes those big cylinders you often see attached to the machine. Those contain the primary gases we use, like oxygen and nitrous oxide. We're talking pure medical-grade oxygen here, folks, the lifeblood of our patients while they're under anesthesia. Now, we can't just have these gases flowing freely, right? That's where flow meters come in. These handy devices allow us to precisely control the flow rate of each gas, ensuring the patient receives the optimal mixture for their needs. We measure these flow rates in liters per minute, and trust me, getting that mixture right is crucial for a successful surgery. Think of it like baking a cake, but instead of flour and sugar, we're using oxygen and anesthetic gases. We need the right balance to create the perfect anesthetic state for each patient. Too much of one gas or not enough of another can have serious consequences. Now that we have our gas flow sorted, let's talk about the vaporizer. This is where things get a little more interesting. The vaporizer is a critical component that allows us to add precise amounts of volatile anesthetic agents to the fresh gas flow. These agents, typically in liquid form, are what actually put the patient to sleep and keep them unconscious throughout the surgery. The vaporizer turns these liquids into a vapor, which is then mixed with the oxygen and nitrous oxide flowing from the gas delivery system. The concentration of anesthetic gas needs to be carefully controlled to ensure the patient remains in a stable anesthetic state. Too much and the patient could experience complications. Too little and they might wake up during surgery. Definitely not ideal. The breathing circuit is the bridge between the anesthesia machine and the patient. It's a closed system that delivers the carefully prepared gas mixture to the patient's lungs and carries away the exhaled carbon dioxide. Think of it like a sophisticated set of lungs for the patient while they are under. A key part of the breathing circuit is the Y piece. This is the part that connects to the patient either through a face mask at the beginning of anesthesia or an endotracheal tube once the patient is asleep. Endotracheal tubes are flexible tubes that go down the windpipe and ensure the airway stays open during surgery. The breathing circuit also contains a reservoir bag, which holds the anesthetic gases and a series of valves that control the direction of gas flow. It's a finely tuned system designed to mimic the body's natural breathing process. In many surgeries, especially those that last a while or involve the chest or abdomen, the patient needs help breathing. That's where the ventilator comes in. This essential part of the anesthesia machine takes over the work of breathing for the patient, ensuring their lungs receive the right amount of oxygen. The ventilator can be set to deliver specific volumes of air or oxygen with each breath, and we can adjust the rate and pressure of the breaths as needed. We monitor the patient's chest movements and the pressure readings on the ventilator to make sure they are breathing comfortably and effectively. There are different modes we can use, from fully controlling the patient's breathing to simply assisting their own breaths. The right mode depends on the type of surgery, the patient's condition, and the type of anesthetic being used. Now, we can't just put someone to sleep and hope for the best, right? We need to keep a close eye on them throughout the entire surgery. That's where monitoring devices come into play. These are like our eyes and ears inside the patient's body, giving us real-time information about their vital signs. One of the most important monitors is the pulse oximeter. You've probably seen this little device before. It clips onto the finger and measures the oxygen saturation in the blood. We also use electrocardiograms or EKGs to monitor heart rate and rhythm, blood pressure cuffs to track blood pressure, and even devices that measure brain waves to assess the depth of anesthesia. These monitors are constantly feeding us information, allowing us to adjust the anesthetic as needed and respond quickly to any changes in the patient's condition. It's all about keeping the patient safe and stable throughout the surgery. Anesthesia machines are incredibly safe when used correctly, but like any complex medical device, there's always a chance something could go wrong. That's why we have alarm systems, our trusty sidekicks, that are always on high alert, ready to warn us of any potential issues. These alarms are designed to grab our attention if something isn't right. For instance, if the oxygen level drops too low, the ventilator malfunctions, or the patient's blood pressure plummets, the alarm will sound, giving us precious time to troubleshoot the problem and keep the patient safe. Imagine the alarm system as the smoke detector of the operating room. It's better to have it and not need it than to need it and not have it. These alarms are crucial for patient safety and give us peace of mind knowing we have backup in case of an emergency. The final component we'll discuss today is the suction system. This might not be the most glamorous part of the anesthesia machine, but it's certainly essential for maintaining a clear airway. During surgery, patients can't cough or clear their throats like they normally would, so we need a way to remove any secretions or fluids that might build up. That's where the suction system comes in. It uses a vacuum to remove saliva, blood, vomit, or any other fluids that might obstruct the airway. We use a sterile suction catheter, a thin tube connected to the suction machine to clear the airway and ensure the patient can breathe freely. Maintaining a clear airway is crucial for patient safety during surgery, and the suction system plays a vital role in achieving that goal. It's another example of how the anesthesia machine is designed to handle a wide range of situations and keep the patient safe and comfortable. And there you have it, the key components of an anesthesia machine. These intricate systems work together to ensure patient safety and effective anesthesia delivery during surgeries. From the precise gas mixtures to the vigilant monitoring systems, every component plays a critical role in ensuring a successful outcome. It's a testament to the ingenuity of medical engineering and the dedication of the medical professionals who operate these machines. Thanks for watching, and stay tuned for more medical insights.